In my psychiatry private practice, I see patients 1 day a week. My current schedule, no joke, is Thursday to Tuesday, Thursday, Friday, Saturday, Sunday, Monday, Tuesday. I do whatever I want, whenever I want. And only on Wednesdays do I see all of my patients. And so the reason that I have set this up is because I wanted full freedom of my life, full financial freedom about being able to work whenever I want, wherever I want to, location freedom, being able to work wherever I want, and time freedom, being able to work at the time that I want to. And the only reason that I've been able to accomplish this has been because of social media. So I've been through residency, I've been through fellowship, right? Like I've showed up for the 8 a.m. consultation liaison rotations and been there till 4 or 5 a.m. whenever, right? Like I've been there for the outpatient visits where let's say a patient's scheduled at 9 a.m. and then another patient is not scheduled till 1 p.m. This was sometimes that would happen in our like child psychiatry fellowship, for example. And so I always remember thinking that this is such a colossal waste of time. Like I could have just moved these two patients to a different day and then I would have the whole day off. Or what was worse is if, let's say, the patient would say that, oh, yeah, I'm in person. And so I would drive to the clinic for that one in-person patient for telepsych. And then they end up canceling. Or they'll say, oh, yeah, let me go virtual. And I'm like, instead of me driving 30 minutes out to the clinic in the morning at 8 a.m. in rush hour traffic, I could have just stayed home and see the patient from home. And even when I was working my attending job, outpatient concierge private practice, I was working at my first attending job there after my fellowship. And so I'm working there. And I remember having to negotiate with the office manager. And I was like, okay, listen, like all my patients are virtual. What's the point of me coming in? So I'm just sitting there in the office. And she would be like, oh yeah, it's good for team morale and stuff. I'm like, one, who cares? Second is, okay, I'm spending my time working I'm in my office the vast majority of the time anyway. My team morale is mainly if I go to the break room during lunch. And C, I just felt, okay, my time is much more valuable than me having to just sit here and pander to a clinic, right? Whose office policies are like just that. So maybe this doesn't apply to you, but as a young 31, 32-year-old, I guess I have different beliefs or rebellious spirit or however you want to call it. In fact, I've always felt this way about just medicine in general. I can work hard, but I want it to be on my terms.